I think we're all set to begin.
Okay, all right. Well, good afternoon, everyone. I'm Lourdes Castro Ramirez, and I'm the Secretary for Business, Consumer Services, and Housing, the Housing Agency. I also have the privilege of serving as the chair of the Homeless Coordinating and Financing Council. So thank you all so much for joining us for this special council meeting today, September the 14th, 2020. The meeting is scheduled from 3 to 5. Before we proceed with roll call, I would like to share with the council and members of the audience that have joined us virtually that Stephanie Welch from our CDCR department is no longer participating on the council. She had to, I think she left CDCR, and so we are working with CDCR for a new appointee or a replacement. So stay tuned for more information in future meetings. So at this time, I'd like to ask our HCFC staff member, Nicole Zaragoza-Smith, if she will take roll.
Yes, thank you, Secretary. Council Chair Lourdes Castro Ramirez.
Here.
Council Vice Chair Emilio Ramirez.
Here.
Councilmember Amy Anderson.
Here.
Councilmember Russell Atterbury.
Here.
Councilmember Alexis Berries.
Here.
Councilmember Gina Bukieri Harrington. Councilmember Corinne Buchanan.
Here.
Councilmember Donald Cavier.
Here.
Councilmember J.C. Cooper.
Here.
Councilmember Gail Gilman. Councilmember Jody. Sorry?
I'm sorry?
Gail might have just joined.
No, actually, can you hear me? I'm here.
Wonderful.
Yeah, we
Thank
can
you.
hear you now, Gail. Thanks.
Councilmember Jody Ketcheside.
Here.
Councilmember Jennifer Loving.
I'm here.
Councilmember Gary McCoy.
Here.
Councilmember Tokes Omishakin.
Present.
Councilmember Joseph Ukashiba.
Here, can we change that to Joe?
Joe, absolutely.
Thank you.
Councilmember Gustavo Velasquez.
Here.
Thank you. The roll call is complete.
No, I'm here. Can you hear me?
Yes.
Gina?
Gina Bukieri Harrington.
Gina.
Councilmember Gina Bukieri Harrington.
I'm here. Sorry, I'm having a little technical difficulty.
Okay, we can hear you, Gina.
Thank you very much. Nicole, do we have quorum?
Yes, we have quorum.
Okay, thank you so much, Nicole. And thank you again to all of the HCFC council members for joining us today for this special council meeting. Just want to take a few minutes to provide some very brief updates and some remarks regarding the purpose of today's meeting. Just as a way of background and a reminder to all of us in terms of the short history of the Homeless Coordinating and Financing Council, I think everyone knows that HCFC was created in 2017 in recognition of the ongoing challenges and crisis impacting our state as it relates to people experiencing homelessness. We know that this is a very complex and challenging matter that requires focused attention and coordination from all entities at the local level and at the state level. And at the state level, the HCFC was created to really bring state agencies and departments together to work in a collaborative and coordinated and strategic manner, coordinating policies and programs and funding to more effectively look at strategies that will prevent and end homelessness across our state. And so, as a kind of top level mission, our focus is to ensure the health, the well-being, and the safety and the stability for all people experiencing homelessness in our state. Since our last meeting in June of this year, a lot of activity has been constant and ongoing, as I think you all know. We have been, as a state and across agencies and departments, doing our best to continue to be proactive and respond, working closely at the local level, providing support, technical assistance, and funding resources to help protect and help create shelter and housing opportunities for people experiencing homelessness. I did have an opportunity, along with Allie and her team, to put together a memo summarizing some of the critical activities that have been ongoing since our last meeting in June. And so you should all have a copy of that. It's also posted on our website if you would like to refer to that. But I do want to call attention to a few things that I think are important for you to be aware of. First, we recognize that there has been a number of federal resources that have been brought to bear to help us respond to the impact of the COVID-19 and the pandemic in terms of the impact that it's having on the homeless service providers and people experiencing homelessness. And we recognize that those new resources also come with a number of guidelines or parameters in terms of how they should be used and what they should be used for, coupled with, of course, state dollars that have been made available. And so to help continuums of care and homeless service providers and local governments better navigate through the various, funding and resources and programs, HCFC put together a very comprehensive guide to help navigate through the various, funding programs. And I want to, commend Deputy Secretary Allie Sutton and her entire team for working on this, of course, with the help of Matthew Doherty, who you will hear from briefly as we go into this conversation on mapping out our strategic action items for HCFC. It is a very good resource, and I encourage you all to look for it on our website. The other area of focus has been continuing to do everything possible to provide information on how to prepare and respond to the ongoing heat events and fires and power shutoffs. Again, very much committed to making sure that we're continuing that level of communication and making ourselves available to assist with providing technical assistance and answering questions and connecting to other resources. The third area that was also captured in this memo was resources and support for youth that are experiencing homelessness and looking at how to better connect to distance learning opportunities. Of course, this is, become much more challenging, and we recognize that, and we're, continuing to do what we can to identify resources, to be able to assist with this ongoing need. And then finally, I want to, just sort of take a moment to also acknowledge that we recognize that, this pandemic, both, as a public health crisis, but also the economic impact that this pandemic has had, has been disproportionately impacting people of color, Black, Latino, Indigenous communities. And so we're very mindful of how important it is for us, one, to have good data to help better understand how resources are being allocated and or used, but also to provide a greater focus on how important it is that we address, these racial and economic inequities in the homelessness systems. So there's, much more that I think we can do in this space, but I want you all to know that we're, very aware of it within HCFC. We're very committed to it within BCSH, and there are a number of efforts that are underway. And frankly, I look forward to the conversation as we go into the strategic action plan discussion on how we may be able to do much more in terms of addressing racial inequities, or really committing to a racial equity and inclusion agenda. The other item that I also would like to briefly share with you all is that the homelessness management information system that HCFC has been leading and working to put in place, that initiative and effort has been moving along very well. As of the latest update, every single continuum of care across the state has submitted a signed data use agreement, essentially accepting and agreeing to participate in this initiative, which will essentially enable us to have data from the local level in terms of the use of homeless service dollars, and really to better understand how services and dollars are being deployed. And eventually, I think that this will be very helpful in shaping policy and informing, the strategies and the decisions that we make, collectively as a council. The goal is to be able to launch HCIS or the HCIS system by early 2021, and we are on track to get that done by, by the start of the year. And then just, the last, point that I will make as we, as I turn this over to both Deputy Secretary Ali Sutton and also Matthew Doherty is the purpose of, today's special council meeting is really an opportunity for us to take a step back from the, regular sort of quarterly meetings that we have and take, the time to better understand not only sort of what our overarching goals are, but to be able to develop a strategic action plan that helps us prioritize the areas of focus for HCFC. I think you all know that HCFC, as at least as outlined in statute, includes 18 different goals, and they're outlined with great detail. And it also, these goals, I think the expectation is that we should all be sort of working together in partnership across state agencies, departments, local government agencies, continuums of care, federal agencies, also, of course, the United States Interagency Council on Homelessness, bringing in homeless service providers, the private sector, philanthropy, and many others. So there are a lot of different stakeholders involved working towards preventing and ending homelessness. And so I think with 18 goals, with so many different partners, I think we all think it's very important for us to spend some time hearing directly from you all and helping really craft and develop a strategic action plan with a set of priorities to guide our work, to ensure that our work is impactful, that it's consistent also with the priority that our governor has and that we have as a state, which ultimately is to get to a point where we don't have anyone living on the streets or without a place to call home. The statistics, I think, that or the numbers that we have, I don't think they're new to any of you, but the last point in time count shows that we have just over 151,000 individuals living on the streets, or individuals without a permanent home across the state. This, represents about 12% of the total homelessness population across, the nation. And so, it's a significant challenge, to say the least. And so as, we go into the conversation today, I do want to acknowledge and thank many of you who already have participated through the interviews that Matthew and Ali have been conducting. They have been very helpful, and I think we'll have an opportunity today to get into just an overall sort of review of some of the key themes and key sort of feedback that has come back from the early interviews. And so just as I end this kind of portion, I'd like to just remind us all that, at the start of the year in January, when Governor Newsom provided his the State of the State address, I think we all know that his focal point was on ending homelessness. And, I think without a doubt, he reminded us all that it is something that is solvable, that we can solve homelessness. But he also, I think, reminded us all that it's not going to happen overnight. And so his quote was, "This crisis was not created overnight, and it will not be solved overnight or even in 1 year. But as a state, we must do everything that we can to ensure that no Californian is homeless." So that's our task, that's our mission, and I really look forward to today's conversation. And so I think with that, I'm going to go ahead and turn this over to,
Meeting summary adoption.
oh, okay, one additional step. Thank you. I'm so glad Allie's here. One additional step before we jump into the action planning, we do have a business item an action item that we need to address. And that is item number 2. We need to adopt the meeting summary from our June 11th, 2020 HCFC meeting. And so I'd like to ask council members if there are any questions on the meeting summary, or if I can have a motion to adopt.
Motion to adopt.
Okay.
Who was that?
Second.
You have the names?
I think we got a motion from Gail. And who was the second?
Russ Atterbury and maybe a few others.
Okay. All right, motion second. Do we need to take roll call or?
Yes.
Okay, it's roll call.
Nicole, can you do roll call?
Yes. Council Chair Lourdes Castro Ramirez,
Yes.
Council Vice Chair Emilio Ramirez,
Yes.
Councilmember Amy Anderson,
Yes.
Councilmember Russell Atterbury,
Yes.
Councilmember Alexis Berries,
Yes.
Councilmember Gina Bukieri Harrington,
Yes.
Councilmember Corinne Buchanan,
Yes.
Councilmember Donald Cavier,
Yes.
Councilmember JC Cooper,
Yes.
Councilmember Gail Gilman,
Yes.
Councilmember Jody Ketcheside,
Yes.
Councilmember Jennifer Loving,
Yes.
Councilmember Gary McCoy,
Abstain.
Councilmember Tokes Omishakin,
Yes.
Councilmember Joe Ukashiba,
Yes, thank you.
Councilmember Gustavo Velasquez.
Yes.
Thank you.
Thank you so much, Nicole. Two other items before I turn it over to Ali. First, we have some very exciting news regarding executive officer, and Ali actually will be providing that update. But secondly, I do also want to remind for those of you that have joined us for this meeting, members of the public, that there will be an opportunity to be able to provide a public comment during the various items that are agendized. And I do want to just kind of share with you how we're going to manage the public comment portion. So to help our meeting stay on track with time, please make sure that your comments are related to the current item that is listed on the agenda or that is being discussed, and wait until the open general public comment portion. We will allow for a maximum of 3 minutes for each comment to keep us on schedule. Members of the public who wish to comment on any item must be, basically the comment must be connected to the meeting, or the individual must be connected through the web conference link. So please take a moment to locate the raise hand icon on your screen, as this will be used to request the opportunity to speak or to provide a comment. If you're connected by phone or telephone only, you will be in listen mode for the duration of this meeting. If you're connected by telephone only and wish to provide public comment, please refer to the public meeting agenda for directions on how to connect to the web conference. And if we have, I don't know if we can provide that, Evan, like is there a web number?
Web link?
Yeah.
The web link is on our website.
Yes, yes, it is on our website. For those who are connected to the web conference, there may be an option for handouts. The council meeting agenda is attached to that. If not, it's available on our website. It's bcsh.ca.gov/HCFC. And the agenda is linked under a section called What's New. It's right in the middle of the page.
Thank you, Evan. All right, and thank you again for for those of you that have joined us online or by telephone. We appreciate your participation. So now let me turn it over to Ali for some exciting news on the executive officer, and then we'll go into the HCFC action plan discussion.
Yeah, thank you, Secretary. So hot off the presses, we have officially brought on an executive officer for our Homeless Coordinating and Financing Council after a very extensive search. Julie Lowe, who will be joining us in early October. Just a remarkable woman with some really great background that I think will be very valuable for the team. Currently is working in youth homelessness efforts, has been doing just a ton on managing and developing of teams, working with a lot of local communities as a consultant, and also brings with her some personal experience in being homeless herself. And so I think the whole range of expertise, both with an MPA from Berkeley and her personal experience, will be an incredible asset to the team. And I really look forward to welcoming her officially at our next meeting in October. She should be on board by then, so you'll all get a chance to meet her then. So very much looking forward to having her to join us. So without further ado, because I know we've got a lot to talk about, I'm just going to dive in real quickly. Evan, if you could go to the next slide here real quick. So I'll try to go through this relatively quickly. I know we've talked about this to some of you in our one-on-one discussions that Matthew and I have been having, and are happy to discuss it further with those council members that we haven't had one-on-ones with yet. But wanted to just quickly go over sort of our intent for developing this action plan before we dive into our discussion. So as you know, and as the Secretary mentioned, HCFC was created in 2017. It did not have any staff resources at the time and was very much focused on ensuring our state programs were in compliance with Housing First by July 1st, 2019. So a lot of our first 18 months together, for those of you that have been around since the beginning, know that those first 18 months was very much dedicated to that. Since then, we have been very fortunate in getting some additional staff capacity and really being able to provide some additional support and structure to this work. And so the hope for this conversation and where we end up landing in this is that with that added capacity and with sort of a few years under this group's belt now, that we have the time now to give this council a bit more structure, a bit more focus, and a bit more accountability. And so we're really hoping to identify priorities for our meetings and discussions, but also to sort of strengthen, the work that we intend to do together and coordinate across one another, across agencies and between state and regional and local partners. So we really are expecting that through these conversations and through the work that we're going to be doing and the vision we'll be setting for ourselves, that we'll be able to align those strategies across agencies and focus on best practices, which will allow us to have a more collective approach to how we administer grants at the state, what kind of impact we expect to have from those grants and that funding, and really be able to understand and measure what kind of practices we need to be encouraging and requiring. So the hope really is that we will identify actions that can be taken both together as a council and together as partners, but also independently. We appreciate that some of our state agencies may need to go off and do some work and report back to our council. And so we expect that what comes out of this is a bit of an accountability mechanism for report out on those meaningful actions that we agree upon in our meetings moving forward. And then, the timing of this council or this action plan in many ways is quite fortuitous, that we are about to be able to translate some of these immediate lessons we learned from the COVID-19 response into much longer term homelessness response activities, really questioning and thinking about business as usual and what we learned when we all came together and had sort of a coordinated goal. And so I think a lot of those learnings, we had a lot of opportunity to move forward with those lessons learned in this action plan. And ultimately, I think this goes without saying, but important to say nonetheless, all of this work and this action plan, I personally commit to you, will be intentionally actionable. And with that goal being to drive progress on preventing and ending homelessness in our state. We do not anticipate this to be something that sits on a shelf and is dusted off every 5 years. We want to ensure that this is something we hold ourselves accountable to. So with that, just a little bit about the approach. So you all know, but we are incredibly fortunate to be able to bring on Matthew Doherty. For those of you that don't know him well, he is the former executive director at the U.S. Interagency Council on Homelessness up until recently, where he did this sort of action planning and strategic planning process at the national level, and also did quite a bit on the implementation of those plans. So somebody that can very easily help us think through how to structure something that is both meaningful and important and is able to be tracked and implemented on. So we're looking forward to having him with us through the entire process that we are going forward, and are lucky to be doing that. We're also sort of in starting this conversation realizing that we really needed to have a grounding framework to have to start the discussions and have the discussions. Not necessarily the framework we end up on for the action plan itself, but something that allows us to ground the conversation. As luck would have it, the National Alliance on Homelessness put out a remarkable framework with some of Matthew's help. I can't say that we're not a little biased, but we think it's been quite valuable, on a framework for an equitable COVID-19 recovery and response for folks experiencing homelessness. And so we're really using that structure. You'll see that here today. Matthew's going to go into that a little bit more here in just a second. But really as a grounding way for us to make sure we're talking from a similar language, addressing similar issues, and understanding what's next. All of this is being done in close coordination with the governor's office. They are incredibly supportive of the work we are doing and eager to see what we come up with. And as the secretary mentioned, we're sort of going about this approach as initially the first layer of the onion obviously is talking with all of you all as HCSC council members. So we've been having these individual surveying conversations with each of you, intend to have a few more of those in the coming weeks since we couldn't fit everybody in before this meeting. But then very quickly we'll be moving on to a broader stakeholder group of conversations, including people with lived expertise. So that will sort of be our next phase between now and this October meeting, including dialogues across state agencies as well. So really trying to bolster up and get as much feedback from all of the different partners and stakeholders as possible. And then we'll be using these meetings as milestones. So you'll see that actually, if you could go to the next slide real quick. You'll see that sort of in the timeline that we've set for ourselves here, that we're having this special meeting right now specifically on the action plan. We'll be having our next 2 quarterly meetings as milestones for this work. So October 26th, we're intending to bring to you all sort of an initial draft of priorities and objectives, get some approval around those and consensus around our focus areas, and then use our December 19th meet or 18th meeting, excuse me, for recommendations for state actions on those priorities and objectives. So really spending the time today and between now and October focusing on a bit higher level priorities and objectives where we want to be spending our time on topic areas and sort of broader focus gaps, and then from there figuring out what the state can do on those specific areas. With an ultimate goal that we are rolling as of March, that we have approval and adoption from the council on our vision and our mission and what we're going to tackle together in the coming year or so. So just sort of a bit of understanding of where we're headed. I do want to say this meeting specifically is just on this topic. Those other two quarterly meetings, you all will have an opportunity to provide the departmental updates. We know there's a ton of great work going on right now, but given that this was a special meeting just for this topic, unfortunately, we won't be able to have time for updates at this meeting, but rest assured, we're very much looking forward to hearing from you all on what your departments have been doing in that October meeting. And so with that, I think I will hand it off to Matthew.
Great, thanks, Allie. And it's great to see everyone. Just very happy to be working with you all on this project, and I've really enjoyed the opportunity to speak with a lot of the council members already, and looking forward to the conversations that we have scheduled in the days ahead. So just very quick overview. Next slide, please. As Allie said, we've decided to use the National Framework for an Equitable COVID-19 Homelessness Response as a structure for these conversations, for the initial thinking about priorities and objectives. But again, it may not remain as the structure that the action plan ultimately uses. The framework is really designed to provide guidance and structure to help communities respond to the intersecting crises of homelessness and COVID-19, and to help them identify what to do and when, and also especially the strategic use of funding in support of the strongest practices for responding to these crises. But it also, importantly, is not just about responding immediately to COVID-19, but also starts to look forward to how do we continue to build and strengthen systems that will serve ourselves and our communities much more effectively moving forward. Next slide, please. The framework is supported by an unprecedented partnership of national organizations, especially led by the Center on Budget and Policy Priorities, the National Alliance to End Homelessness, the National Healthcare for the Homeless Council, and the National Low Income Housing Coalition. And then we have implementation and follow-up tool support from the National Innovation Service and the Harvard Institute. And just as Ali mentioned, in the interest of full disclosure, one of my other consulting projects is working with all of these organizations on the framework itself, and initially the initial drafts of that, revisions, and some of the supporting tools. But behind this work is all of the weight and brain power of these multiple organizations. Next slide, please. So the framework really has several key principles, and this is part of why we thought it made sense to start our planning process using this framework, because these principles are very much aligned with how California has been trying to prioritize its activities and work related to homelessness and responding to COVID-19. So the key principles, I'm not going to walk through these in too much detail, but really do focus on advancing racial justice and equity and put that at the very center of the work, not as an enhancement, not as an add-on, but really as a central element of how do we respond to homelessness and to the worsening of racial inequities resulting from the COVID-19 pandemic. The framework does put an emphasis on helping those with the highest needs first, and really trying to prioritize especially homelessness-specific resources for people at the greatest risk of homelessness or people who are already experiencing homelessness. Another key principle is growing partnerships and building out the relationships between everyone who needs to respond to these kinds of intersecting crises, and knowing that in the initial days of response, sometimes the partnership, say, between the continuum of care organization and the public health agencies were not that strong, and they didn't have much to build from. So they had to create new partnerships, new structures, new ways of working together. The fourth principle is really focused very much on getting people into housing, and knowing that housing that is people's own place to be, stable and safe for them, is the best option, both during the pandemic itself and as we enter the period of economic recovery. And then really trying to make sure we're all focused on acting quickly and urgently. And I think California at the state level has been a remarkable example of really responding with urgency and with an all of government response. So these principles feel very much aligned with how California is trying to proceed with the work. Hopefully those are principles that resonate with the council as you think about the work. And again, the focus on racial justice and equity, the secretary talked about the state of the state march earlier. Governor Newsom in that speech earlier this year actually centered equity within his focus on homelessness as well, highlighting, quote, that homelessness impacts everyone, but not equally. Some communities have been hit much harder, and really focusing in on especially the disproportionate representation of Black Americans experiencing homelessness, but also other populations who are more at risk of homelessness and overrepresented. Next slide, please. I'm going to run through this very quickly, but just to give everybody kind of an equitable grounding in an understanding of the framework. It's organized into 5 action areas, again, to help people think through an organized approach of responding to the wide array of needs that the pandemic and the economic crisis are worsening, focusing on unsheltered people, shelter, housing, diversion and prevention, and then again, really looking forward and how do we strengthen our systems for the future. And again, it's not just about the COVID-19 response, but it really is about what are we learning through this response? What is this response revealing about our challenges, and how do we do a better job of having strong systems in place to both respond to future crises, but also do a better job of preventing and ending homelessness. Next slide, please. So very quickly, and I know you've all had a chance to have these slides, so just to quickly highlight that the focus on unsheltered people really is about providing people with the opportunities for safety and hygiene resources while they are unsheltered, and that needing to be an immediate response, but ultimately knowing that we need to connect people to safer sheltering opportunities to keep them safer during the pandemic, and then really does focus on the importance of striving to drastically reduce unsheltered homelessness, and knowing that if a future crisis comes, we don't want to be in the same kind of situation with this large number of people experiencing unsheltered homelessness and the public health challenges that that creates. Next slide, please. Sheltering is a key part of the framework. This is obviously an area in which California has really helped lead the way for the country as well in the establishment of non-congregate emergency sheltering strategies, focusing on keeping people safer, figuring out ways to sustain and expand sheltering opportunities both during the pandemic, but also as we move forward. And I think one of the big challenges that we as a country have in front of us is thinking through how to transform and reimagine our approach to sheltering, and knowing that large congregate shelter settings are not good settings during a public health crisis, but they also have never really been effective settings for the system for ending homelessness and for bringing people inside and putting them on pathways out of homelessness. So I think that's a big chunk of work that as a country we're going to be tackling, how to think about sheltering moving forward. Next slide, please. So it really does center the focus on housing, and that connecting people to permanent housing is both the solution to people's homelessness, but it's also the best alternative, the best option, opportunity for people during the pandemic itself. And we need a diverse array of models to respond to different levels of need. And we need to expand the housing resources and options that are available to create more flow out of shelter and out of homelessness generally, and really a focus on equitable outcomes. I do want to emphasize here that as we think about housing and rehousing people, that is both part of the longer term strategies, but it's also very much part of their crisis response and keeping people safe during the pandemic itself. Next slide, please. The fourth action area focuses on diversion and prevention. So reducing new entries into homelessness, really trying to zero in on the people who are most at risk of homelessness and effectively reach those populations. So really zeroing in on targeting people who have recently exited homelessness but may not be fully stable yet, people from historically marginalized communities, people who have the lowest incomes, and people whose support networks have fewer resources, so that there may well be reasons to focus on eviction prevention during this crisis, but also really thinking carefully about how do we do homelessness prevention, knowing that oftentimes evictions are not a direct line into homelessness, So trying to think carefully about the homelessness resources having the most impact on reducing entries into homelessness itself. And then the fifth action area, next slide, please. It does focus on strengthening our systems for the future and really making sure we're moving forward with stronger systems, systems that are doing a better job of addressing issues of racial justice and equity, systems that have stronger partnerships in place, including with public health systems, systems that are even more focused on housing outcomes and employment outcomes to support people's long-term success, and systems that are better prepared for future health crises and disasters. So that's the framework in a pretty quick overview. I'm going to turn it back to Allie to see if there are questions or feedback on the framework itself.
Thank you, Matthew, and thank you, Allie, for beginning the conversation in framing the action planning process. As Matthew mentioned, I think at this point we'd like to take an opportunity to take questions and feedback from council members on this first portion of the action planning process. And so if you have a question, feedback, or comment, I think you can just, for council members, you can just go ahead and unmute your phones and or raise your hand and we'll call on you.
I believe as council members, you should just be able to unmute yourself if you'd like, if you have any comments at this time.
So I have a question, Matthew, and I think that it would just be helpful if, on this point about congregate versus non-congregate shelters, there is a really interesting podcast focused, it was released over the weekend, on family homelessness in New York. And there is, some really kind of interesting data and information regarding, kind of the different approaches to, congregate versus non-congregate shelters. And so I'd like to see if you could provide a little more sort of information and definition so that I think we all can understand like the pros and cons and the model of, when do we choose to go to a non-congregate model versus a congregate model, and why should we be more kind of focused on non-congregate, settings?
Sure.
Yeah.
I can try to do that quickly. I think this is an area that probably is worth further discussions as we dive further into the action planning process. So non-congregate settings have oftentimes been in place for families experiencing homelessness who often have dedicated rooms. It might not be a lot of space, but each family is in a self-contained unit that is often the model, not always. But we see that having been in place for family homelessness more than we've seen it in place for individuals experiencing homelessness. I think the challenges with congregate settings is not just the public health risks and the risk of exposure during this specific pandemic, but oftentimes the feedback that you receive from people experiencing homelessness is they do not want to enter those settings. They don't feel safe. They don't feel like they're productive settings. They don't feel like it's an environment which actually helps them on their pathway out of homelessness. And it's not a good first step for them, creating the challenges of trying to find ways to end people's homelessness directly from the streets, which sometimes can be more challenging, trying to keep in touch with people and find them. So as sort of a front door for the homeless services system, large congregate settings have often been a door that people did not see as a good opportunity to walk through for a variety of reasons, and oftentimes grounded in past experiences with those settings. So I think communities are really trying to identify the alternate models of sheltering that will reach people who have not typically come into shelter previously, so that they can more efficiently end people's homelessness, and also are finding that people are reporting better experiences and better resolution of crises and of health issues. So there's starting to be emerging evidence even out of the COVID-19 non-congregate settings in other communities that the people's experience and their health is improving because of their access to those settings, more so than we see in non-congregate settings. So I think there's a lot more to unpack there, but I think both from an efficiency system and from an experience perspective, there's lots of reasons to think about alternate approaches than the models of sheltering that we were using previously.
Great. Thank you. For those of you that are interested, I think the podcast was called "The Children in the Shadows." It's very illuminating. It was very worth. It's about an hour and a half though, but just a warning. Okay, any questions, council members?
I have a question.
Yes, Joseph?
So, decompressed congregate shelter settings, I've never heard that term before. Can you just explain exactly what that is?
Matthew, are you, I can take it if you're having a hard time.
I don't think we can hear you, Matthew.
So I can just take it real quick. I think I can answer this real quick.
I did lose my audio, so I missed the question.
Oh, there you there. But I just real quickly though, what that essentially means is when COVID hit, to ensure social distancing and ensure that people could maintain safety within congregate settings, they had to figure out ways to really thin out, decompress. There's lots of different words folks have used for it to ensure that the congregate setting could be as safe as possible based on CDC guidance of social distancing norms.
Well, thank you.
Yep.
I have a question.
Yes, Amy.
Not sure how we're doing this. I guess I just, and it's interesting because those two other questions, I think, touched on this in a way. I guess I'm just curious to what extent we should be thinking about and defining the action plan through a COVID lens or not through a COVID lens. And I don't know how that would play out, but I am curious, right? It does sound like because of COVID, we've been able to test some new shelter options. But I guess this question of congregate versus non-congregate, like, are we doing that because the non-congregate because the outcomes are better or because we're concerned about COVID? I guess I'm just trying to understand the applicability of the COVID lens to the action plan.
Matthew, if you're not there,
Great, so I take first stab at that.
Oh no, I might be losing you, Matthew.
You want? Can you hear me now?
Yes, yeah.
Okay. Yeah, I'm gonna try to dial in by phone. Yes, you can hear me?
Yes, we can hear you.
Yeah.
I apologize for this. So, okay, great. So I think as we're thinking about the action planning, the COVID-19 context, which remains unpredictable, and we don't know what the resolution, we don't know the time frame. We have to stay focused of working within that context, but we're also trying to work beyond that context and think about what needs to happen, even if we're able to move effectively out of this public health crisis into the future, trying to capture the lessons learned, but also build systems that even before the pandemic would have been more efficient. And I would say the non-congregate settings is an emphasis both from a public health perspective, but also from an efficiency as a way of reaching people and actually effectively helping them. So I think it serves multiple outcomes.
Sorry, Amy, were you going to say something? I apologize.
No. Thank you. I appreciate that. It sounds like both and.
Exactly.
Yeah, I don't really have a question.
So we have.
I just wanted to offer maybe a reflection because it sort of goes to Amy's question. You know, I would hope as a council, two things. One is I think what COVID has shown us across the state and with incredible leadership at the state level is that we can act with innovation and urgency. Just the 9 Bay Area counties alone, you know, back of the envelope math was able to quickly either decompress their shelters or bring off the street close to 5,000 individuals or families. during the COVID period where they were decompressing and trying to get folks off the streets. So I think it's a total yes and to what Amy was also saying, but to me, it's around rethinking the whole way we've been doing this work and a lot of our systems and structures, because to me, we have a lot, we've had some great successes, but we also need to do business differently if we have 151,000 unsheltered or homeless or homeless individuals in the state of California. So I see this as a huge opportunity for us to think outside the box, to take risks on innovation that maybe we wouldn't have done before, because we showed through COVID we can do it. And I think congregate shelters is a great example. I'm sure everyone at this council would agree, when folks have a sense of privacy, agency, and dignity, their own little space, if possible, their own private bathroom, that they can thrive and recover from the trauma of homelessness in ways they can't in other settings. So I just hope as a council, we think big and innovative when we look at this, and also look at it not so much, we have the constraints of resources and scarcity, but I just really hope we can go big with the plan. So I just wanted to offer that reflection as we continue the conversation.
Thank you, Gail. And just for those members of the public, that was Council Member Gail Gilman.
Madam Chair.
Yes.
Gustavo. So I also have a few reflections from the overview, the general overview of the action plan, and my reflections are very much obviously as a council member, but also as the director of HCD. It's as I come to these meetings, I always think of the ways in which the department can support the role of the council and vice versa. And first of all, let me just say I'm really excited about the work that just from the meeting with Ali and Matthew. Very excited to see kind of the expertise come on board to help us define kind of these strategic objectives. And I'm really excited in particular about the 5 or 6 action areas that have been designated. Really looking forward to dive deeper as a contributor to the development of the plan, but again, in kind of my HCD frame, also in really executing the plan when that is ready, in whichever way our department can play a role. And let me just offer kind of 3 areas in which, since we've been meeting with Ali and Matthew, 3 areas that my staff and I have been kind of thinking about, again, in the development, but also execution of the plan. And I encourage my colleagues, other members of the council, to start thinking about within their capacities, professional, personal capacities, how they can help kind of advance the interest of the development of this plan. And so the 3 areas, let me start with first with probably the very, very important area of a strategic collaboration. I'm thinking here, for example, that HCD partners with a wide variety of stakeholders and organizations from the homeless response sector, largely through the funding programs to the communities that we have, and certainly, this is sort of an important asset that we have, and how we can encourage the development of the action plan from a strategic collaboration standpoint. Our department also exercises a unique role regulating local land use and housing policies, affirmatively furthering fair housing, promoting accessibility and non-discrimination strategies around supportive housing. So these are the areas that we think here internally, how can we really bring our contribution to bear when it comes to the collaboration that we have with the council, with every member of the council, and with the plan that is being developed. The other area, second area that I'm thinking, is data and transparency. I think it's going to be extremely important the way we continue to collect and report information, for example, ourselves, through our funding programs and through our roles overseeing the local land use planning, housing policies, housing permitting, that kind of data collection and data democratizing is going to be very important. And I know the council has been moving in that same direction, leveraging local HMIS data to inform housing policy, which is an important role of the council. So in addition to strategic collaboration, data and transparency, I think is going to be a second really important kind of overarching theme as we develop this plan. And lastly, which is very much embedded in the principles of this action plan, is equity, right? Been thinking, in what way can we support that specific area? Well, we work on a number of fronts to, again, combat housing discrimination as a state, affirmatively furthering fair housing. This all includes, implementing state and federal statutes to identify impediments to fair housing, promote housing choice, address community disparities through programs, through policies. Home Key right now, it's a good example that is elevating, accessibility and non-discrimination strategies as a foundation to the future and the programs that the state sponsor, that the state supports. So that's another area, equity, that very much integrated in the action plan, where we look forward to really participating in the development of the plan. So again, I encourage all the council members to continue to look at your professional capacities, the communities you come from, the associations you're a part of, how all of that expertise, all of the instruments that you have at your disposal can really support the development of this plan. And again, I can think of those three: strategic collaborations, data, and equity as foundational in the support that we can provide. So very excited about the general framework, the action areas, and look forward to the next several weeks and months to put together something that we can really, as a collective, commit to and execute.
Thank you. Thank you so much, Councilmember Velasquez, for your comments. And I think this is maybe a good segue into the next item on our agenda, item number 4, which is really a continuation of the action planning process, but with now sort of a focus on, as was mentioned before, both Matthew and Ali have been scheduling interviews or surveys with each of the council members, and there's been a lot of very good substantive ideas and feedback that has been provided, including, as some of the comments that Councilmember Velasquez provided. And so I think this is a good opportunity for us to hear from Matthew and Ali and a summary of some of the key areas of focus or themes, and then invite I would invite the council members, to continue the conversation in terms of, as Gustavo mentioned, kind of challenging and encouraging each of us as council members to think about what can we do within our departments or agencies to really strengthen the system, and to bring homelessness as a sort of key priority within the work that we're doing. So I'm going to go ahead and turn it over to Matthew and Ali to walk us through this next item number 4, the HCFC action plan discussion.
Thank you, Secretary. So I'll just quickly a little bit of framing before I hand it off to Matthew. So as we've mentioned a few times, we've been having these really, really fantastic conversations with each of you. I hope you all feel that they've been useful as well, but just really very enlightening, and want to thank those of you that we have already talked with, and preemptively thank those of you who we will be talking with in the next couple of weeks, just for your thoughtfulness and your engagement in these discussions. It really is going to be sort of the backbone by which we develop some of these priorities and objectives. So just thank you for taking this so seriously and for providing such useful and collaborative feedback in these discussions. So I'm going to hand it over to Matthew here in a minute to go over some of the emerging themes we've heard from the conversations thus far. And then we'll be able to have some time for you all to discuss. And Matthew will sort of guide us through a facilitated discussion for most of the rest of the meeting. Just a little bit of context, hopefully helpful thinking about the kinds of feedback you might provide. For those of you that have already had conversations with us, if you don't feel like your key points, sort of the key action areas you really think are critical for preventing and homelessness and ending homelessness in our state are sort of represented in the emerging themes as we've framed them, please speak up and let us know that. If there's things that really still need to be included or on the table, please speak up. And for those of you that we haven't had conversations with yet, I would just say, we don't expect this to be your one and only shot. That's why we're having these ongoing conversations. And so for those of you we've had conversations with, and for those of you that we haven't, but particularly for those of you we haven't, don't feel urgency to get through all of your thoughts in the short time we have together today. We are going to have more time to have these conversations. This is very much just a starting point to start framing some of this work together. So just appreciate the continued engagement on the work, and we'll hand it off to Matthew to share with you all some of the things that we learned and heard from you all in these discussions thus far.
Great, thanks, Allie. So next slide, please. And I'm going to try to keep this brief so we really spend most of the time on the discussion. As we've been having these conversations, we've been really seeking people's input on priorities for the council and for state agencies generally. Lots about programs and services at the state level that could be strengthened in a variety of ways. Opportunities for the state to strengthen its partnerships locally, nationally, federally, in every direction. So just framing that here, because when we get to the discussion section with you all a little bit later, going to be prompting around these same kinds of categories: priorities, programs, services, partnerships. Next slide, please. So really, just if we sent out the slides ahead of time, so I'm hoping that folks had a chance to look through it and got a sense for the theme. So I'm not going to walk through each of these bullets. That would take far too long. So just going to try to highlight a few things that were pretty consistent themes on each of these slides. So first, just started with overarching things that didn't really fit neatly into elements of the framework itself. I would say that in every conversation, there was a lot of optimism about the role that this council can play in strengthening active partnerships across the state agencies and defining strategic roles for the council, but also for each of the agency, that there's a real motivation to take the focus and the urgency and the flexibility that was mobilized in response to COVID-19 and try to keep that same culture of flexibility, urgency in the work to address homelessness moving forward. And I would also say that there really is an eagerness to see the state step into a even stronger leadership role, providing guidance, training, tools, and resources. And at the community level, there seems to be a real interest in seeing the state step into that role even more fully, and some specific ideas, things that could happen. Next slide, please. I think another thing that came through in a lot of the conversations was just seeing the value of setting bold goals and being ambitious in a planning process as a means of getting as far as you possibly can. And a lot of resonance on goals that focused on racial equity, that focused on rehousing people, and on reducing unsheltered homelessness. And those objectives came through clearly in a lot of the conversations. And thoughts about the role the state can play in driving local goal setting and progress, from incentivizing, mandating a variety of ways to pursue those objectives. And a real interest in making sure we're thinking about the state carefully as a set of communities with different capacities, different needs, different challenges ahead of them, and thinking about how to pursue work that all parts of the state would benefit from. Next slide, please. So then when we move to unsheltered homelessness, I would say one of the key themes here was balancing a focus on sheltering as a strategy for unsheltered homelessness, but ultimately seeing that housing is the strategy for unsheltered homelessness as well. But it's not one or the other. There's a need to do work in both of those areas in order to have the maximum impact. That came through in a lot of conversations as well. came through a need to continue to innovate, test, and demonstrate what are the most effective strategies and interventions for addressing unsheltered homelessness. And also ideas were generated about how access to state-funded services and programs could be improved for people while they are unsheltered and could be a part of their pathway out of homelessness, including, I would say, a strong focus on the need for people to access healthcare resources. Next slide, please. So shelter, there really was recognition of how much had been mobilized in response to COVID-19 and looking for ways to build upon that urgent work. Obviously, some of that work is already underway as the state programs move forward. A need to expand sheltering capacity, but to be careful that we're doing that, not seeing them as the endpoints, but as the steps in on the pathways out of homelessness. We touched upon this earlier, but just the opportunities to reimagine what sheltering looks like. There will be interim housing programs coming through Home Key. I'm interested in exploring recuperative care options, a variety of ways to think about what it means to shelter people successfully, and also the importance of ensuring that sheltering options are meaningful opportunities for people that are safe, that lead them somewhere, and that treat people with respect and dignity. And that came through in a lot of the conversations as well. Next slide, please. Some of the emerging themes around housing is that, and this will come as no surprise to any of you, but that housing production and affordability needs to remain a primary focus of the state, and the state can have a real impact in that area, and a recognition that we need a full range of options and models of permanent housing opportunities for people. There was a fair amount of discussion in the conversations about making sure that we are reaching households with the lowest incomes who are most at risk of homelessness, people who are exiting homelessness, that we're thoughtful about how the housing is aligned with the needs of the populations so that our housing strategies have the greatest impact on homelessness possible. And a fair amount of discussion about how to strengthen regional approaches, including people flagging the need for people as individuals and families to be able to access the services they need across jurisdictional boundaries or to have flexibility about where they are served. And that came through in many conversations as well. Next slide, please. Diversion and prevention. There was definitely discussion here about needing better data to document the pathways into homelessness. For the state to be thoughtful in differentiating strategies that are about diversion, really at the front door of the experience of homelessness, homelessness prevention for those folks who are most at risk, and eviction prevention, and that the state may well need to do work across all those areas, but be thoughtful about that work and the resources that are being used. And definitely some focus on opportunities to strengthen partnerships that could prevent people from entering homelessness, including health, education, corrections, foster care, and other systems. But I would say re-entry planning and services came up in multiple conversations as one of the priorities as well, as did strategies for preventing youth homelessness. Next slide, please. So then a lot of thoughts about what the state could do to strengthen systems moving forward. And some of this has already been reflected, but the role of HCFC ensure that as a council you're learning from communities and from other states, a strong focus on racial equity and the opportunities created within the data systems being built, opportunities to build consistent approaches to addressing equity across state-funded programs, and a need to invest in training capacity building at the community level to implement those strategies. As Ali highlighted earlier, a lot of work for the council focused on housing first, still seen as a need for public understanding of the strategies and capacity at the community level to implement housing first effectively.
Oh, I think we might have lost you there, Matthew. We lost you there for just a few seconds.
Maybe, sorry about that.
Yeah, I think if you can pick up from housing first. Yeah, we're having some connectivity issues, Matthew. You're kind of coming in and out, and so Let's see, we'll give,
Can I pick this up? Sorry, Ally, do you?
I can jump in, Matthew, if helpful. We can tell, I think, when you're back because you're not fuzzy anymore. So your video becomes clearer.
I'm going to dial in by phone, so give me a minute to do that. But if you can cover it moving forward for a bit, that would be great.
Yeah, sure. We can
Thank
hear you
you.
now, of course, but that will probably change. So, so we can head on to the next. Gone through all of those. So some other things that we heard in the conversations, really thinking about documenting homelessness status or housing instability among homelessness funded state programs. So in his point about learning from other states, there has been some really good learnings about how best to identify who might become homeless in other safety net systems or other sort of institutional settings that they interact with. How are we able to make sure that we're catching folks potentially before they become homeless, or identifying those that are homeless but receiving services but not necessarily accessing the homelessness system. So some good conversation around that. Coordination between state agencies and local and tribal partners. We had some really thoughtful, I thought, conversation around how to ensure that we're reaching out to some of our tribal partners a little bit better as well, but just generally thinking about a better line of communication, a more consistent line of communication around the kind of things that we can provide and support. Fostering regional strategies and collaboration. So I think Matthew talked a little bit about this, but just really trying to understand that we're not, each individual community is not solving this by themselves. And so, with the data we will be pulling out from HDIS, but also just in what we already know is happening locally, how do we make sure that we're all rowing in the same direction regionally to ensure that we're not duplicating efforts or worse. And then state federal partnerships and federal policy agendas. So there were a few comments about making sure that we at the state level and specifically HCFC really understand our partnership and our asks of the federal government, and so making sure that we don't lose sight of that in what we say we have control over. We also have the ability to advocate for things we think are helpful for our state. And then removing obstacles together, sort of really being mindful that there are quite a lot of barriers out there that require multi-agency approaches. And so really trying to make sure that we can do that. We saw some really great examples of that during COVID and the immediate response to COVID. And we want to try to build on those efforts together to try to break down some of the unnecessary obstacles that we're throwing up for ourselves. So Matthew, if you're back, feel free to chime in if any of those that I didn't fully address.
I am back by phone. I'm hoping that's better.
Yes, we can hear you. Great.
Yep. No, and I think that was great. So then if you want to move to the next slide, please. So then there's also a lot of interest in the ability of the state to help foster the testing of innovative models that focus on long-term success for households. So knowing that this exit from homelessness is not the only goal people have for themselves, but really trying to focus on how does that exit support their ability to pursue other goals of long-term success. And I think we heard a fair amount of the role that the state could play in trying to guide and set expectations regarding how state resources are used, and setting consistent standards for the intervention so that there is a more consistent approach across the state as state level resources get implemented. And a lot of interest in, as I touched upon earlier, more technical assistance that can help drive progress at the local level. So those are the key themes that came up through the conversation so far. I'm hoping for folks who had a chance to participate that sounds familiar to you, some of it. Obviously we didn't hit every bullet on every slide, but hopefully you see your feedback captured within these categories of themes. And we're going to turn to discussion and really want everybody to feel like you can participate in the discussion, whether you had a chance for this surveying conversation yet or not. And so we can move forward to the discussion part of this. On the next slide, please. So as you think about what you've heard so far, really want to focus in on priorities for the council. What ideas, objectives, or strategies do you see as bubbling up as the top level priorities for the council, for inclusion in the action plan, for state actions that could have the most value, add the most value, and have the most impact? other people who had thoughts about priorities that you think are emerging through all of these discussions and information.
Okay, so I think Matthew's inviting us to discussion now. This is a great opportunity to continue on. Yes, I think we have Councilmember Corinne Buchanan.
Yeah, hey folks, Corinne Buchanan, Assistant Director for Housing and Homelessness for the California Department of Social Services. I was moved by Gail's call to have a big vision, and I think I also agree that what we've accomplished in the last number of months should put the wind beneath our sails to really think big. I think especially the work that we have done as a state for Project Roomkey. I mean, I think having stood up in a matter of months, 16,000 non-congregate new shelter beds, net new shelter beds across our state, which we know have served at least 22,000 individuals. That's an increase of 50% in terms of our state number of shelter beds, and again, in a matter of mere months. And I think for me, the big take home messages were, one, you know, we can do this. If the will is there, we can make this happen, and we can overcome obstacles that stand in our way to getting people the resources that they need. Number two, that we've got to do it through a collaborative approach. I think if emergencies are good for anything, it's bringing people together who typically may not be working side by side every day. And certainly that was the case in Project Roomkey. We saw firsthand how public health, managed care organizations, social services departments, COCs, service providers, and people with lived experience came together to stand up these resources very quickly and effectively. And then second, I think as we've watched many of the rehousing efforts that have come to grow out of Project Roomkey, especially as communities are thinking about HomeKey, how they're thinking about what resources that already exist in their communities. They're keeping an eye towards what flexibilities exist, and they're coming to the state and saying, can you offer additional flexibilities? So I think we want to keep with us as we move forward this barrier busting mentality that I think is what made us successful during this emergency period. So those would be my my thoughts around what we'd hope to see in an action plan out of the council.
Great. Perfect. Other council members who have thoughts about priorities and vision for the action plan.
This is Councilmember Gilman. Corinne, thank you so much for ripping off sort of what I think is so important for all of us. I had a couple of things, and maybe Matthew, it was implicit in sort of the broad categories, since I know this was an overview, but one was in the housing section of the plan. I really do hope that we can elevate and really sort of put out into the ether the wider use statewide of a flexible subsidy pool. You know, I do think it's really important that, well, brick and mortar is key to our success as a state, and we all know that we're in a having a massive housing crisis for all income levels, but particularly extremely low income and individuals and families experiencing homelessness. I think there's been a lot of success in Los Angeles County in particular, and in San Francisco, of really showing how you can use flexible subsidies to help augment rent either permanently or time limited in the private market. And that especially for homeless individuals and families who are working, that subsidy level might look very different. So it's a really cost-effective solution. So I'm just really hoping we can maybe call that out in the housing section. And then in the sort of systems section, I know we talked a lot about racial inequities and disparities. And I think we should put a pin to revisit as a council. I know we had our timeline of when we want, you know, that we were going to hopefully ratify this in March of 21, if I read it correctly, Allie. But I do think if Prop 16 passes, it could be a game changer for how we address that. So I don't want us to vote on or have a bunch of set recommendations that can't pivot if that happens, since we know that particularly Black, Brown, and Indigenous communities across the state are disproportionately represented. And if that passes, we might have a new opportunity
to work to correct that inequity. And then my final comment is, I don't know how we'd want to structure it because I don't know if it's needed everywhere, but I do think, and this is an anecdotal comment, I think there's pockets of the states and jurisdictions that actually have a lot of gaps, and regardless of funding, would have a hard time still executing probably on the goals that we're going to adopt. So whether it's a gap analysis in regions that either the department or Allie and your team and Corinne's team might already have this data, who struggled during the rapid flexible response due to COVID. Because when I talk about gaps and capacity, to me, it's not just dollars. It's, do they have the ecosystem of the nonprofit service provider community to execute on the work? Do regions and jurisdictions have the network and capacity at their COC level? Do counties have the capacity, again, regardless of funding, to rapidly process and stand up new programs? I have a concern that without a real gaps analysis, we don't know where the state stands from a capacity perspective.
Great. That's great. And that actually the need to map out resources and capacity came up through several of the conversations. So I appreciate you flagging that. Other council members who have thoughts on priorities? Let's go to the next slide and people can weigh in on either priorities or the next questions. So the next question does focus on the programs and services that the state controls specifically. And so what are some of the biggest opportunities for those programs, those agencies, to drive progress in any of these 4 areas? So again, if you want to jump in now, you can weigh in on that question, or you can still stay focused on the priorities question. But other council members who have thoughts about where the biggest difference could be made, and how state agencies and programs could drive more progress.
This is Amy Anderson.
Great.
Hi. Just a couple of thoughts. I reiterate what Gail just shared around, I guess I was thinking about it in terms of provider capacity, but certainly COC capacity. I mean, it was indeed spectacular what the providers were able to do in terms of Project Roomkey. But if we're going to expand, you know, even further beyond that type of that infrastructure, we're really going to need to help support our provider community. I think just a couple of other thoughts that come to mind. You know, Corinne laid out all the different kind of stakeholders that were able to come together during the crisis to kind of achieve these successes. I think one of the sometimes barriers that perhaps was missing that also facilitated that was just the general public. And I don't know, I don't want to be a Debbie Downer, but I think it is just important for us as we're putting together the plan is to take into consideration that oftentimes the general public is a barrier to almost all of these solutions, whether it's you know, creating resources for unsheltered people or shelters or housing. So, you know, how do we address that as we're putting together the action plan, whether it's an education campaign or just knowing that that important stakeholder needs to be ultimately considered as we you know, put the action plan into action. And then just one last idea is just around the federal government, right? Like this is a state action plan, but just given the even more severe crisis around housing instability and homelessness that I think we're looking at in the state, that is a federal level you know, need, and I don't think, right, we need to continue to push and advocate at the federal level for them to step up and help address these needs.
Okay. Perfect. Thanks for that feedback.
This is Tok Somashakin with Caltrans. Just a quick comment to add on priorities, on the priorities part of the work that's happening as we put the plan together. You know, an immediate concern for us at Caltrans is where we have encampments that create a safety danger for the moving public. So where we have unsheltered people, unsheltered or homeless, in a position where they're pretty close to the operational right-of-way of the roadway, it is of a big concern to us. One of the things that's we've seen an uptick in the last couple of weeks, or in the last several months actually, is we've been getting a lot of calls from mayors, city leaders, community leaders from across the state, concerned about people who are unsheltered sort of running out into the roadway, or encampments that are becoming very close to the roadway. And actually, there have been several incidents where somebody is almost hit by a car, or actually hit by a car. So it's a situation that's dangerous for both the moving public and the person that's unsheltered as well. And just, you know, focusing in on those situations and trying to see how we can get them in a sheltered condition is important. And I guess the other thing, this is a little bit myopic from our end, is the infrastructure that we oversee as well. You know, there have been a few cases. There was one in Stockton recently where an encampment essentially blew up under a bridge. You know, something catastrophic could have really happened. There was no loss of life in this particular case. The graphic, the images from that particular case are pretty frightening to see, scary to see. But, you know, if it was another situation, if it was a year ago and it happened during rush hour traffic, a bridge, you know, exploding with people driving across it, the thoughts, I mean, you know, the challenges related to that we would have had to address, I can't even begin to fathom. So, you know, prioritizing the moving public, you know, moving the unsheltered from the moving public and finding solutions for them. And again, something that's a little bit more myopic from our end is the infrastructure. We have a responsibility for where the public could be in danger. Thank you.
Great. Thank you for those comments.
Hello, this is JC. Can you hear me?
Yep.
Oh, hi. So one of the things I just wanted to raise, and I really support the comment made by a previous individual around conducting a gap analysis. I think one of the biggest opportunities we have is to really do a data-driven kind of goal or plan. I think it is very critical in order for us to kind of know where we should prioritize based on data. I also would put in a plug, it's clearly on the list, but for diversion and prevention, I feel like it oftentimes can be pushed to the lower part of the plan because there's initial need right in front of us, but some long-term investments on the diversion and prevention. I was really happy with some of the things put in the previous slides. I think is key, obviously, with the Department of Healthcare Services. That is a large role we can play in this space and have a lot of opportunities to collaborate in that space. And so really just pushing for how we define our biggest opportunities or priorities should be after we complete, you know, a full kind of gap analysis or run various data polls to inform this committee or council to make decisions about where we should invest both short-term as well as long-term investments to move the needle down the road.
Okay. Perfect. Thank you for that. I'm going to ask for a quick time check. So, Ali or Lourdes, can you let me know, should we be wrapping up, or do I have about 5 more minutes, or what's your take on timing?
We can continue, Matthew. We have 10 to 15 more minutes, so we can continue.
Okay, terrific, thank you. So other folks who have thoughts about priorities or specific programs and services at the state level that could have the most impact?
Hey, Matthew, this is Russ Atterbury. I just wanted to add that I think one of the things that a big opportunity that the state has is to have a great communications plan. I think each person has talked about it. Amy talked a little bit about it, talked a little bit about it, about the general public being gaps. But if we have a great communication plan that shows the results of the actions that we've done, and the general public can see the results through a communications plan of what impact the state has had through these actions that we've taken during the pandemic and even before. When people see that, and they can see the positive results that it's having on lives and the state impact, the budget impact, all those things that we talk about. I think that's really important to allowing us to continue to progress. So that's just my 2 cents on improving a communications plan.
Okay, perfect. Other thoughts around priorities, things that bubble to the top is most important, or agencies, programs that could have a great impact here?
This is Corinne. I'll just share another tidbit from our work with Project Roomkey. I'll just share that we have many counties who are saying to us, listen, if only we had more rental subsidies, we could get people out of hotels and into housing right now. So I think there's a real urgent and pressing need to focus on rental subsidies to connect people to stable supportive housing as quickly as possible.
Okay, great. I'm just going to quickly, if we can go to the next, sorry, go ahead.
Matthew, I was just going to mention that we do also need to provide time for public comment. And so I think when I mentioned the 10 to 15 minutes, I want to remind us that we also need to make time for public comment. So I think we can go to the next slide and then we'll open it up for public comment.
Okay, perfect. This is the third P in our conversations today that's been around partnerships. So just quickly would welcome any final thoughts council members have around priorities, the programs and services that most impact, or opportunities you think the state has to partner across state agencies, with federal, local, or tribal partners, or other partnerships that could strengthen the responses to homelessness. So again, before we move to public comment, any final comments from council members across any of those questions? Priorities, programs, partnerships, anything that people want to make sure you have a chance to weigh in on?
Can I? This is Jason Loving. You know, we have until 1/31 to keep at the tsunami of people becoming homeless to really focus on this together. It's so much money that's needed to even pay the haircut workout in, 3088. And so, it's hundreds of millions of dollars. We could save ourselves a ton of trauma and people a ton of trauma if we all were trying to do the same thing. We're going to pay as many 25% back rents as possible, but this really should be a statewide effort, and everybody needs more money, and it's on such a short clock. So in the last bucket, right, partnerships, like how quickly can we act, right? I'll join any committee to that regard. We have a plan to do that here that probably could, happen anywhere. But that's just, we're going to be in a real, it's going to be hell, worse than it is, if we don't do all of this in the next few months.
Great, I appreciate you flagging the ongoing urgency of this work. We haven't moved past the urgent stage of this work. I appreciate you flagging that.
I know a lot of this is planning, right? But I mean, we could jump now and get ahead of a lot of what we're going to need money for later if we can keep people from losing everything. And they're losing everything. 60% of everyone we've helped have lost every dollar. The only reason they're not in the streets is changing in January. Otherwise, it's all good, Matthew. I mean, really, it's just, this is like, I'm consumed with this one, right? How we do this is we can.
Yep, appreciate that.
Councilmember Loving, I very much appreciate you reminding us all of the critical importance, you know, for us to also think ahead to a real present issue, right, that's in front of us. And, you know, I think as the council member has mentioned, you know, the legislature passed AB 3088 and the governor signed this bill into law, which provides protections for individuals that are unable to pay their rent. You know, these protections are will be in place through January 31st of 2021. Our agency, BCSH, has been very engaged and involved, working with a number of you know, folks within agency departments and then across state government, but more importantly, working closely with stakeholders and local governments to get information out to help families stay housed, or, you know, to keep people from losing their housing. But at the end of the day, you know, it is really important for us to not lose sight that without additional rental or federal dollars, that we, you know, may have more people entering homelessness. And so I think that there is, you know, definitely it's not lost on us. And so I think the challenge for us is, as we move through this action plan and developing the action plan, you know, staying focused on the urgent matters that we need to continue to address as a council and push for, but also laying the groundwork for the midterm and long-term, you know, solutions to continue to move our, you know, efforts in our system to do better in terms of, you know, services, shelter, and long-term housing options. So I, you know, I was also kind of thinking about the comment by, you know, just there, the comment that was made earlier by one of our colleagues also regarding the importance of what we are beginning to see in terms of more individuals maybe in encampments and the kind of health and safety issues. That's a very pressing issue that's, you know, before us. So I think the challenge for us is, how do we continue to be nimble and collaborative in addressing the issues that are in front of us, while also developing a more integrated plan that helps us solve these issues kind of long term. And so that this is, you know, I think this is the challenge that we have before us, right? You know, staying committed to developing the plan, but also not, you know, not losing sight of the fact that this is not a plan to have something nice in writing. And this is, you know, we're calling it an action plan because our focus is, as these issues are identified and solutions are addressed, if there's something that we can immediately do, I think we should do that. So that's, yeah.
Right. So I think we should. So this council hasn't really used its, I don't even know, could we use our authority to who do we talk to say, right now, emergency money for this kind of assistance in the way that you've conveyed, like HEAP and HAP money, is so critical. Like how, because we are going to be in more trouble in the spring if we don't do this now. I mean, I don't sleep because of this. I'm sure many of the other people on this call don't sleep. Can we ask for some? I'm asking, you know, where everybody's broke, right? Jurisdictions are broke. I will sign any letter or make any request, but I feel like we should be asking for something as a group. This is representation of the whole state. I know that everyone, I'm imagining no one thinks this is not a problem, right? I mean, So I'm just putting it out there that we have a couple months.
Yes. Yes,
Couple months.
thank you so much. Let us follow up on this item. I know our governor has been very vocal about this and putting also, letters to Congress on the importance of prioritizing rental assistance or and additional federal support, both for state and local government. I also know that there's, a lot of momentum, I guess, that is continuing to be built in terms of a call to action by Congress and the federal government. So there may be something that we can do as a body. We just need to make sure that we check on, can we draft a letter that gets signed by all members of HCFC that gets addressed, to our congressional delegation or Senate delegation. So let us follow up. But I appreciate you bringing this up to this body. Thank you.
Thank you.
And this is Gary. I might also have some insight on that, so I'd be happy to work on that.
Great. Thank you.
You definitely good.
Thank you, Gary. Okay, I think we're gonna, Matthew, if you're okay, I think we're gonna go ahead and open up the public comment portion of the agenda. And so I'm gonna turn it over to Evan to walk us through the instructions on how to activate that.
Sure, of course, thank you. If anyone, any attendee would like to make a public comment, please take a moment and find the raised hand icon on your meeting window. So this will be the time you will indicate with the raised hand you'd like to make a comment. And I will unmute your line and you'll have 3 minutes to make your comment. I will give you a moment to locate that and see if we have any public comments. All right, it looks like we have a comment from Sharon Rapport. You are unmuted.
Thank you. Good afternoon. I'm Sharon Rapport with the Corporation for Supportive Housing. Appreciate this good discussion and the direction of the strategic plan. I do want to just support the comments of a couple of the council members around doing a needs and gaps analysis at the statewide level, not just around local needs and local system improvements, but also on a statewide level for the state programs and trying to figure out how to fund what the state needs in terms of housing and services for people experiencing homelessness. I would also support the comment that we do need to think about rental assistance in terms of getting people housed, and that is something we're lacking at the state level. And finally, I would just recommend that in the housing section that there is mention of the need for affordable housing for people experiencing homelessness who don't need supportive housing. That is one gap that we've historically had in California. HCD is doing some significant work around remedying that gap, but we have a long way to go. And so I would just make that recommendation. Thank you for the opportunity to comment.
Thank you, Sharon, so much for your comments.
Do we have any additional public comments? Now would be the time to raise your hand in the meeting window. I'll give a couple more moments just in case anyone's having trouble locating it. It's just a small hand icon, likely near the camera or the microphone. Looks like we have one. Looks like we have one from Dre Air Salon. I apologize if I'm pronouncing that incorrectly. Your line is open. Dre? Do we have a comment from Dre Air Salon? All right, looks like they've put their hand up.
Do we have anyone else, Evan?
I'm not seeing any others.
Okay, I think we just had one public comment. I think before we wrap up this item, Matthew and Ali, or both, or one of you, if you can just sort of walk us through, like, what are the next steps in this process, given today's feedback, and then I think we'll move into item number 5. So if you could summarize for us next steps.
Matthew, do you want me to take that?
Sure, go ahead. Yep, go ahead.
Okay. So we'll plan on finishing up our council member conversations with the handful of folks that we haven't had one-on-one survey discussions with yet. Take all of the really useful feedback today and start having conversations, and we'll just say, if you have recommendations on broader stakeholder groups that we should reach out to, we've been doing some brainstorming of that ourselves as well, but we'll be reaching out beyond the council to make sure that we're hearing feedback from a range of stakeholders. And we'll be doing that between now and the October meeting, with the intention of providing you all with a little bit more lead time than we did this week on the PowerPoint slide, but in advance of that October meeting, having some materials for you all to review to come to the October meeting with, ideally to be able to move forward on some general visioning and framework. Just to be clear, this October meeting, we really are expecting will be much more just making sure we have some same grounding principles and objectives that we can start to add some actionable items at the state level too after the October meeting. But we will be providing some material, really encourage and request. I know everyone is incredibly busy during these stressful times, but if you can ensure to take a look through those materials before coming to the meeting in October, it will just put us in a good spot to have a really robust conversation that gets us ideally to some final actions by the end of that meeting. Anything you want to add, Matthew?
No, I think that is great. So just looking forward to diving in with folks we haven't had a chance to talk with further, and then engaging in further conversations with all of you along the way.
Thank you. Thank you both, Ali, Matthew, and thank you to everyone that participated. Just, kind of my reflection on, the discussion, was jotting down some of the key points. Reminder that, we should think big and not be afraid to, take risk in terms of innovating and thinking differently about how we tackle this issue, continuing to embrace a collaborative approach, focusing on rehousing efforts, and also thinking more creatively about the flexibilities that are necessary, particularly at the local level, to be able to provide more solutions, more housing and additional supports. Very much also like making sure that we not lose sight and understand the issue by understanding and maybe conducting a gap analysis. Of course, also understanding the provider community, where, they're, what's working, where they, there's a need for additional support from the state. Another sort of key takeaway is the importance of education and awareness, and not losing sight of how important it is for us to lift up the work that is happening, to both help educate, but also to, to celebrate the progress that is being made as we're, continuing to do this work. Also, a reminder that there are some pressing issues in front of us, including, addressing encampments and addressing the need for rental subsidy or rental assistance or additional federal support. And so we will definitely follow up on that to see what we may be able to do as a body to address that pressing issue. And then just a reminder, I think from Councilmember Velasquez, that everyone plays a key role, in helping implement this action plan once it's in place. And so having you sort of think through, like, what, can your department or agency do? I think, we heard from Councilmember Velasquez a commitment to bringing in, more data and information and transparency. Also, of course, continuing the commitment to racial justice and racial equity. So a lot of good comments, good ideas, and good work. I'm actually very excited that we've come this far, and I'm very much looking forward to reconvening next month in October to for a quarterly meeting, and also an update on the action planning process. I do want to move now to item number 5, which is the last item on our agenda for today, and this is an opportunity for the council to consider items for future meetings. So I do want to see if I think this is an opportunity for for council members, if you have an item that you would like to get on the agenda, or an item that you would like for the council to consider for our next meeting. This is the time if you'd like to share that.
This is Council Member Gilman, and I asked this question not knowing if it's possible, but I'm aware, at least in this last legislative cycle, there were many bills, many of them that did not make it to the governor's desk, but some that did, that actually influenced the makeup and the authority of this council. And I'm wondering if we could have, when appropriate, a standing item to just be briefed. I know we can't take positions on them or necessarily influence them, but to be briefed on moving forward in the future if the Assembly or the Senate is putting forward legislation that would influence what we're doing. I think it would be a nice FYI for all of us, if that's possible.
Yes, we can definitely do that. So we will make sure to agendize an item on legislative bills. I think it also would be beneficial for us to include just a quick summary also, or update on some of the other housing bills that relate to the work. So thank you, council member, for that. We'll make sure to agendize that.
So I have something. Can you hear me?
Yes.
Okay, so speaking solely from my profession, I know that there are cases where we run into people and we do things very improperly. A real quick example, somebody who has tardive dyskinesia is mistaken for somebody who's under the influence of drugs. So instead of getting help at an emergency room, they get booked into the county jail. So we have a lot of opportunities where we miss out on opportunities to get someone into the specific help that they need. So I think being first responders, we run into a lot of people a lot of times that are ready to commit to something, whether it be a program, whether it be some type of shelter option, but not understanding how to respond to that, we push it aside and we move on. I think it's very important that police officers change their mindset and start understanding how to look for these signs, start understanding what mental health issues are, and that you do have to take more time to talk to people to truly understand if they have a mental health issue that's an emergency and needs to be addressed right away. In some cases, there were times where officers go out to calls and they're evaluating somebody's mental health who's suicidal, and in 5 minutes they decide that the person is not suicidal, and then that person goes and hangs themselves, jumps off a bridge, whatever, because they didn't take enough time to invest in the investigation of figuring out whether or not this person needs mental health help. Anyways, that's a really longer than I wanted to get into explanation about what I think from my perspective is important to help people who are homeless out, and that's understanding mental illness and understanding homelessness and how we can respond to that. The police must do a better job. I'm not bashing my profession by any means. It's just we're not trained to handle these types of situations. And being the officer in charge of the homeless intervention team here in Fairfield, I look at things through a totally different lens now. And my colleagues are more than willing to learn. And it's a shame that we're really falling short on serving this community of people.
Thank you. Thank you so much for bringing this up. I think, as we move forward with, our future council meetings, I think it would be helpful for us to build in time to take a kind of deeper understanding on some of the issues impacting individuals that are experiencing homelessness, so that we are also better educated and can maybe make more better decisions or informed decisions. And this area of mental health and mental illness, and what can we do as a state, maybe something that we can work with in terms of identifying a presenter that can provide maybe some information and models and data that might be helpful, especially as we craft the action plan. So Joseph, let us follow up, and we may follow up with you just to determine the right kind of level of presentation, and who may be who we may be able to invite, to help kind of co-present or present this item. Well, I'm not sure if we're going to be able to do it for the October meeting, but we definitely will follow up. So thank you, appreciate that.
Thank you.
Any other suggestions or thoughts? I did want to mention that I had, conversation with Ali regarding identifying a speaker or presenter to invite to one of our future council meetings to speak to racial disparities among people experiencing homelessness. And so I think we're going to follow up on that. If you have any thoughts or ideas or suggestions, please reach out to Ali. We'd love to, to follow up. Anyone else? Okay. So this is also an opportunity for, we have public comment on items that are not on the agenda. This is an opportunity for the public to weigh in. I'm going to turn it over to Evelyn to see if we have anybody in the queue. Great.
All right, thank you. I'd like to remind anybody to please indicate if you'd like to make a comment with the raised hand icon.
Yeah, doesn't show much.
It looks like I'm seeing no comments.
Okay, no comments. Anything else from council members before we come to the end of today's meeting? Okay, seeing none. Thank you so much to everyone for being here with us today. Special thanks to Matthew Doherty and Ali for guiding our action planning process and today's discussion. We do have a meeting next month in October, so stay tuned for the agenda and the materials for that meeting. And in the meantime, of course, we leave you with our contact information for updates on HCFC. There's our website. Also, for members of the public, if you have any questions regarding any of the items discussed today or any of the items under the HCFC jurisdiction, please email us at hcfc@bcsh.ca.gov. So with that, please, stay safe, stay healthy, and thank you all so much for being here. Take care.
Hey, everybody. It's good to see you.
Thank you, everyone.
Thank you all.
Thanks.